So bear with us as we bring Neil on. And again, if you've got questions that come up that you want to pop in the chat as Neil's talking, feel free to do that. And then we'll come to them all together after Neil's presentation. Neil's slides are up already. Great. Neil, over to you.
Great, thanks very much. And really pleased to be here today. I've clicked on presenter view, so I think my computer's just chugging away. It should be with you in a minute. But I'll just start off by introducing myself. So my name is Neil Jennings. I work at the Grantham Institute, which is a climate change research centre at Imperial College in London. I'm really pleased to be here today, and I'll be focusing on the co-benefits of climate action. So linking what we do in terms of reducing our greenhouse gas emissions with stuff which can have significant benefits for other parts of our day-to-day lives. So I think for me, I always think of the kind of what needs to happen around climate change and the way in which we need to bring our citizens with us. I always think of there being two kind of key questions that we need to ask. The first is what gets people out of bed in the morning? So what is a kind of positive vision of the future that people want to be part of, and how can action on climate change help in that respect? And secondly, what keeps people awake at night? So what are the other day-to-day challenges that we have, and how can action on climate change help in that respect? How can action on climate change help to address some of the key things which are also challenges in society as well? So I'll just explain here on that kind of second point, this graph. So this is data from an organisation called Ipsos Mori. So they do a poll of a representative sample of the public once a month, and they ask an open-ended question: what issue are you most concerned about? And people can say whatever they like, and more than one thing. And then all those responses are kind of coded into different groups. And so what this graph shows from left to right is the different years, so going from 2007 to today, and then on the top to bottom, or bottom to top, is the percentage of people responding to that poll who've stated a specific thing, something that they're worried about. So what you can see in the kind of graph, the green line here shows the proportion of our country who, or at least this sample, which is representative of the country, the proportion of the country is concerned with the economy, which, as you can see, was really high after the economic crash in 2008. You can see this orange line, which is the NHS, which you can see was gradually increasing until recently. And just one kind of minor anomaly to point out here is that this blue line here, you can probably guess, is COVID. And so the way in which things are kind of shown here is the fact that the reason this NHS has gone down is just because they've split up the kind of the health side of things between COVID and the NHS. But what I guess I would draw attention to really is this dotted line. So this is the proportion of our population who are concerned with pollution or the environment. And so what you can see is this steady increasing trend until recently. Indeed, pretty much this time last year, pollution or the environment was the third biggest issue of concern for the UK public, and it's still there in the sort of fifth or sixth, and is equivalent in concern to things like crime or education as well. But what this graph kind of illustrates is that, bearing in mind our ambitious targets to reduce greenhouse gas emissions to tackle climate change, we need to be thinking about the way in which action on climate change can link in with some of these other issues that are day-to-day concerns for members of the public, in order that we make sure that we are kind of making efficient use of resources, and also tackling some of the other key challenges that we're facing as a society. So bearing this in mind, what myself and some colleagues did was we looked through all the kind of academic literature to find examples of where of the impact that climate change had upon kind of helping to tackle some of these other key challenges that were faced in that shown in that previous graph. And we put that all together, and then we worked with a charity called Ashton, who put together a toolkit of really great examples from all around the country of where councils were taking action on climate change in a way which was also helping to tackle some of the other key challenges faced by their local citizens. And I'll include, there's a link, a couple of links there if you want to follow up with any of that, and I'll be drawing on some of the kind of examples from Ashton's work. And so what we did, having looked through all this academic literature, we grouped these co-benefits into 4 different themes. So that's around the benefits for health, improving our health and benefiting the NHS, benefiting the economy and helping to reduce unemployment, helping to tackle issues like poverty and inequality and to improve the quality of our housing, and also around things like energy security, how moving towards more wind and more sorts of like solar energy can help to reduce our dependence on oil and gas from other parts of the world as well that can sometimes be politically kind of volatile. And so what I'll do now is I'll show you a little video. Hopefully technology works, and this gives a kind of 1.5 minute overview of what I mean by these co-benefits. So I'll play that now, and hopefully the audio should be playing on your computer.
Our world is warming, but taking action on climate change can make all of our lives better, and here's how. Improving the energy efficiency of our homes helps to alleviate poverty by making it cheaper for everyone to keep themselves. It also reduces the risk of illnesses like asthma and pneumonia and saves the NHS money. Electric vehicles reduce air pollution and help all of us to breathe clean air, even in city centres. Cycling and walking more also reduce pollution and improve our health, while a diet with less meat is lower in saturated fats and reduces our chance of getting heart disease and certain types of cancer. Growth in the low-carbon economy creates jobs, while climate action reduces the risk of extreme weather events which may otherwise cause disruption and increase the cost of our food and our insurance premiums. Energy efficiency and renewable energy make the UK more secure by reducing our reliance on imported oil and gas. And on the international level, climate action reduces the risk of conflicts emerging over access to resources. And of course, action on climate change reduces the damage done to the natural environment and to vulnerable species like polar bears, helping to preserve the natural environment for our children and grandchildren. We still have time to avoid the worst consequences of climate change, and there are so many benefits to taking action now. Our research contributes towards a cleaner, greener, fairer future. So join our mailing list or follow us on social media for the latest news and commentary on climate change and the environment.
Okay, so hopefully that gives you a kind of example of what I mean when we're talking about these co-benefits, and I'll just provide you with some more practical examples. So, and this is focused on energy efficiency. And so we have a situation at the moment in the UK where if you're living in poverty, you're disproportionately likely to live in a home which has a poor energy efficiency rating, so an F or G rating. You might have seen these on your home energy performance certificates. And so the situation of living in poverty and then living in a home that's hard to heat because heat is leaking out of the roof and out the windows means that you're more likely to be unable to adequately heat your home, which puts people in a horrible situation where they might be faced with the choice of either eating or heating. That has consequences to our health, both our physical health and our mental health. It increased costs to our health service to look after the people who are getting ill through particularly respiratory illnesses. That has an impact on our children who are living in those properties. They're more likely to miss days of school because they're ill, which has an impact obviously on their educational attainment. The parents are more likely to miss days of school, miss days of work, either because they're having to stay home to look after their kids or because they're being made ill themselves. And that knocks on upon the kind of productivity of our workforce, increase the cost for our health service and potentially increase costs for benefit payments as well from people having to drop out of work through being unwell. And there's this currently a kind of a vicious cycle where the experience of living in a cold home means you're more likely to get ill, more likely to miss days of work, and therefore more likely to lose income as a result of missing days of work, particularly for people who are on an insecure contract. But of course, it doesn't need to be that way, and action on climate change can help. So by improving the energy efficiency of our houses, we can help to break some of this link between poverty and housing so that people can live in a home that they can afford to heat. So we reduce the costs for the health service, we improve people's physical and mental well-being, kids miss fewer days of school, parents miss fewer days of work, the productivity of our workforce is improved, and of course you've got other stuff at the same time in terms of creating jobs in that area, in terms of working in the energy efficiency sector. And it helps to break some of this vicious cycle. And a really nice practical example of this comes from Islington Council. They have a project called SHINE, called the Seasonal Home Intervention Network. And this is where their council's housing team have teamed up with local doctors, and where doctors are seeing particularly elderly members of the community going in regularly with kind of respiratory related illness due to the living in a cold home. With their permission, their details are passed on to the council. The council go in, they do a kind of an audit to check what improvements can be made to improve the energy efficiency. They then help to secure funding for those elderly members of the community to make those changes. And so you then kind of deal with the root cause of that person's illness, i.e. their cold home, rather than just dealing with their symptoms, their pneumonia, for example, and then just sending them back to the very home that had made them ill in the first place. It's a really nice practical example. And similar example from New Zealand, where they tracked the impact this kind of project had on the kids living in those houses, and basically found that the kids, the winter after, they'd had improvements to their housing in terms of making it more energy efficient, kids miss 21% fewer days of school. So real tangible impact upon people's lives, while also helping to reduce the impact on climate change as well. Just to give another example, I'll whiz through one around kind of air pollution. So we have a situation in the UK at the moment that there are around 40,000 premature deaths a year as a result of poor air quality, and we know this is an issue in London. Some colleagues at Imperial did a study where they looked at all the evidence of the link between poor air quality and the impact on our bodies. And their key conclusion was that every single organ of our body is negatively affected by poor air quality. So from things like dementia, from Parkinson's disease, from heart disease, from various different forms of cancer, to things like asthma and even things like acne as well, exacerbated by poor air quality. And so there are solutions that are existing and that are being implemented and rolled out across the UK to tackle some of this problem. I'll give a quick case study from Waltham Forest in North East London, where they invested in lots of walking and cycling infrastructure with funding from the mayor, did things like road closures and improving infrastructure to make it easier for people to walk and cycle, to make it more kind of comfortable, more safe. And so they implemented, say, for example, 24 kilometres of cycleways. They gave kind of cycling proficiency training to 15,000 people. And as a result of that, the residents in the area now walk or cycle for an additional 41 minutes each week, which clearly is good for people's health. And we have other challenges, like I mentioned, in terms of kind of the obesity crisis we have in the UK as well. So it's good for that. And what they found is in that kind of 10-year period in the area, they went from having 56,000 households who were exposed to illegal levels of air pollution to only 6,000, still 6,000 too many, but a 90% reduction in the number of homes that were exposed to poor air quality as a result of some of these changes. So this intervention, so some people from King's College London, the university there, did a study to look at the impact that these changes would have. And their estimates was that a child born in that area now will live for on average 6 weeks longer than it would have done before, such as the changes that have been made in quite a short amount of time in terms of the impact it's had on air quality, while also helping to reduce greenhouse gas emissions by helping to get people out of their cars. And they also found that there had been some kind of, while there's changes in this specific area that they targeted, there have been some small increase in traffic on the kind of main roads outside, but the residential roads has significant increases in traffic. And this gives an example. This is 3 years after the project was implemented, which I guess kind of illustrates the need to make sure these projects are seen through and to really achieve those benefits. For the people in the area where those programs was implemented, car and van ownership had reduced by 7% because it was much more safe to walk and cycle. So people just ditched more, 7% of people ditched their cars. They found that there'd been no negative impact upon things like ambulances and their response times. They also found there's some really interesting benefits which hadn't necessarily been expected. The changes led to an 18% reduction in street crime, and they also found a 75% reduction in the risk of being injured in road traffic collisions as well. And they also found that there was no negative impact on the areas that were outside of this particular region that they'd targeted. So a really significant improvement in terms of people who are being hurt in road traffic accidents. So that's an example of one of the kind of solutions that exist and they're out there already. Here's some examples of others. I've mentioned energy efficiency in the top left already, and the example on the right gives the kind of example from the transport side of stuff. Obviously things like installing solar generation on roofs is a great example. And the bottom right is the incorporation of what we call blue or green, well in this case green space into urban areas. So adding in more green space, which helps to reduce the urban heat island effect, so that on those really hot summer days it helps to cool the temperatures slightly, helps to improve air quality. Also really good for mental well-being as well. Access to green space is really important, which I'm sure many of us have appreciated, particularly over the last 12 months. And it also provides a really important service in adapting to climate change in terms of we're likely to see more extreme weather events, more extreme rainfall events. Having more green space helps to absorb some of that water, so it reduces the chance of flooding, which is particularly relevant in urban areas as well. So I'll finish off with this kind of image, which I came across on Twitter, which I thought was kind of really nice in terms of the way in which we envisage, kind of going back to that first question I asked of what's the positive vision we want to see of our future. So I guess the challenge for you is to think about what you want Lambeth to look like in the future. And this is an example. So when we think about places which are really good for transport, for example, we often think of places like Amsterdam, where loads of people walk and cycle. this is a picture of Amsterdam in the 1970s. And this guy here basically says, remember that every time you hear someone say, well, we're not Amsterdam, that this was what Amsterdam looks like. And when you now look at Amsterdam, you've got 38% of all journeys there being done by bike, compared to something like 2% in the UK. And I'm sure if you ask people who live there now whether they'd want to go back to that, they wouldn't. So I really encourage you to think about the positive future you'd like to see for Lambeth, obviously with stuff which is good for climate change, but really encourage you to think about how action on climate change can link in with many of the other key challenges that we're facing in our society today. And they're my details, and thank you very much.
That's great. Thanks so much to both of you for those